All right, well, good afternoon, everybody. My name is Hillary Mintz, and I'm the Public Information today to talk about a confirmed case of measles in Waukesha County. This is the first confirmed case in the state of Wisconsin so far this year in 2026. So we have two speakers here today. We have Ben Jones, the public health officer here with Waukesha County, who can talk about our team's involvement in this case. And we also have Dr. Sandra Amadon from Pro Healthcare, who can talk about signs, symptoms, and vaccines related to measles. I do want to warn everybody that due to some patient privacy concerns and the ongoing investigation, we may not be able to answer all of your questions, but we're going to hear from Ben and then the doctor, and then we'll open it up for questions. Thank you.
Thank you. So Waukesha County Public Health received a notification of a positive measles test on Saturday afternoon. This is an adult from Waukesha County that had exposure to measles out of the country. Immediate action was taken to work with that individual to trace their movements, identify any close contacts they had when they were infectious. We have already contacted well over 100 people, and as we continue to learn new information, we continue to contact individuals that were potentially exposed. We do believe there's lower risk to the general public, and we are still early in the public health investigation, so as additional exposures are identified, further notifications will be made. If people are exposed to measles, we will contact them. Public health staff quickly jumped into action this weekend to ensure people that were exposed confirm their vaccination status, provide education, and advise them on next steps. Anyone that is not vaccinated will be quarantined so they don't further the spread of measles in our community. So far, we've received excellent cooperation, really facilitating a smooth process. We're coordinating closely with our state partners, including Wisconsin DHS. We will continue to monitor anyone that we've identified that was exposed for potential symptoms. But again, based on our current findings, the risk to the public remains low. What we're asking the public to do is to know your vaccination status, check WER. We are following CDC guidelines, and as I said, we will notify anyone that we have identified that has been exposed to measles. Now I'm going to turn it over to Dr. Amadon to talk about measles a little more.
Thank you, Ben. Hello, I'm Sandra Amadon. I'm by training a primary care physician. I work for Pro Healthcare. And just a little bit about what is measles, because we haven't seen a lot of it over the last several decades. But it is a viral illness that's characterized by fever and rash. Typically it starts with a high fever and malaise, which is kind of a deep-seated fatigue. Cough and runny nose are common. Runny eyes are common as well. The common term pink eye or conjunctivitis can happen with it. And after a couple of days of those symptoms, then a rash typically starts, and it starts generally, not always, but generally on the head and spreads downward onto the trunk and the limbs. The palms of the hands and the soles of the feet can typically be spared. And those symptoms can all last for a week or so. And can be contagious anywhere from 5 days before the symptoms start to 4 days after the rash starts. One of the best protection is actually vaccination, which is felt to be safe and it's recommended. And discussing that with primary care providers would be the best course of action.
Can you just elaborate just in terms of the timeline, because it takes a while for symptoms to appear, correct? So this individual came to Waukesha County or was diagnosed on Saturday. Had they already been showing symptoms? I guess what's the timeline there?
Yeah, the challenging aspect with measles is the initial symptoms are more flu-like, right? And given that we're in a flu season, people don't always assume measles. But when this person progressed to a rash, knowing they had external travel, that's when they were prompted, they actually contacted urgent care. We helped facilitate testing because obviously it was suspicious. Right now, us helping people get tested for measles isn't necessarily unusual, but getting a positive is. So we facilitated that testing and had it sent to the State Lab of Hygiene and got those results Saturday afternoon.
But was it days that had gone by since his or her return from international travel until that Saturday? Like, what was that?
Correct.
So less than a week?
People are quarantined. You mentioned how some people are, they are.
We do have people quarantined. I don't have those numbers exactly. We're still doing those calls right now. But if people don't have their vaccination status or can't prove it or know they weren't vaccinated, we are quarantining them until they meet the qualifications to get out of quarantine.
So what is the measles vaccine rate in Waukesha right now? Do you know a number at all?
It depends what population we're talking about for vaccination rates. I believe overall we're about 90% for school-age children. But obviously, measles is a very contagious disease, so people can still get it.
Can you talk about the vaccine themselves? Is it important for people to get it, right?
Yeah, I don't know if you want to talk more about the vaccine.
Yes, the vaccine is the safest way to prevent getting measles. It's very safe. It's been around for a long time, and it is recommended still by the CDC, even with recent changing guidelines. The MMR is still recommended.
Ben, this is the first case of measles in the state this year. What about years past? What were the numbers in 2025?
Last year, there was a large outbreak, I believe, in Waukesha County for the state. There was 36 cases there. I believe those were the only cases in the state that year. We have not had a case here in Waukesha County in quite a few years. I was part of a large investigation back in 2008. But measles is pretty uncommon, fortunately.
So it's been almost more than a decade.
Correct.
Have you guys been in contact with the local school districts? I know kids back in school spread easier.
So, part of this, again, we've been investigating this for less than 48 hours. Part of this is kind of putting this notice to the public that we do now have measles in our community, but we also do believe the risk is fairly low. We are being aggressive in following up with everyone exposed. And again, I'm implementing quarantine, assuring people are educated. So I think it is challenging to stop measles outbreaks. As you've probably seen nationally, there's lots of measles cases. There was over 2,000 cases in the United States last year. But I do think we have a strong approach.
Why do you say that the public risk is low?
Because there was very limited exposure to this individual, and everyone that we know came in contact with this individual is in the process of being contacted.
Were there any children? I don't know if you can answer that.
There was a range of people in contact, and again, I believe we have all our staff working to work individually based off the situations that those people had.
Can you tell us what country she went through at all? Can you say what country she went through?
I actually don't know the country. We are actually working with DHS and the CDC to try to track down that potential source of the measles, but we don't have any further information on that.
Do you know that she traveled by plane or by vehicle?
I believe it was by plane, but again, I don't have all those specifics.
You talked a little bit about Waukesha County last year. Are there any lessons to learn on how that became an outbreak to 36 cases that you guys are trying to implement now?
The main lessons with measles, as the doctor said, MMR is the greatest way to prevent it. I think us being very, aggressive in our timeline of following up with people, the goal of quarantine is that so people, if they do become sick, they're not out in the public. So the quicker we are able to do that, we prevent any further spread.
What's the timeline for a quarantine on the measles case?
If people are if they're exposed to measles, they typically will get it anywhere from 7 to 21 days after that exposure.
So in other words, if you're quarantining someone, they have to be quarantined for up to 21 days?
It wouldn't start till day 7, so
Okay.
it's roughly 2 weeks.
2 weeks.
And just a question, like if the patient, somebody thought that they had measles, they want to go to the hospital to check out, what should they be wearing? Like wear masks, wear gloves and everything, just like we've been doing with COVID-19?
That's a great question, and I think it also bears repeating that, we're in the middle of flu season, which is a respiratory virus with a lot of those same symptoms. The rash is the thing that kind of separates it a little bit. So just getting the message out that being on the lookout for that rash can be imperative in nailing down the diagnosis. But you bring up a great point, and if you have questions about if you have measles or not, the best thing to do is contact your primary care provider. Call them first. That's better than just presenting at a clinic because it keeps everyone safe, and your care provider can direct you the best place to go to get evaluated and tested. But your question about a mask is a good one, and wearing a mask is a great place to start. But I would pair it with making sure you contact that primary care provider to see where should I be seen and by who.
Any other final questions? One other quick thing as we end things, we will be sending out an updated news release, and as the doctor mentioned, call your healthcare provider first if you have symptoms or signs. If you have any other concerns for Waukesha County, the number for public health is 262-896-8430. We're going to have that on the release, but again, that's 262-896-8430 for Waukesha County Public Health. Thank you all for being here today.